name is Phil, and it started in 2014 where I had an accident and affected my dentures, my mouth and all my teeth, and eventually ended up with about 13 teeth left in my mouth, and decided after consultation with my dentist that I should do something about it. And after a lot of talking with him, he gave me some alternatives, and they were to either or one of the alternatives was to pull the rest of the teeth out and have dentures fitted, and which I wasn't too happy about. And I asked him what other alternatives were available, and he said, well, you could probably have implants done with bridges and so on, and I thought, well, that probably seems a little better. So I started investigating that. He helped me to investigate that. He also suggested that I'd look also on the net to find ways and means of getting quotes here in Australia, which I did do, and which was got to the point where it was just too prohibitive for me to go ahead, simply because of the fact that it was just too expensive to have done so. So I continued on the net and started searching around, and I started with basically searching what would be the best implant available in the world today. And with that simple question, something that kept coming up all the time was by a company called Simpladent. He basically said, look, you know, there are many ways of doing this, but the best is for you to consider obviously coming over, or rather he gave me an option that was available at the time, to go to his clinic in Montenegro, particularly in Budva. Budva is a lovely seaside resort town where he has a clinic, which is a fully decked out clinic. I was surprised how well decked out it really was, and with that opportunity I asked him for a quote which was considerably cheaper, and so decided to go ahead with that. No, not painful at all. In fact, I couldn't believe how not painful it was. I didn't experience any pain whatsoever. I went in the morning. They took out the rest of the teeth that I had left in the morning, and had the implants in by about lunchtime, and left the clinic ready for the next part of the procedure, within 3 or 4 hours. I went back to the hotel. I was taken back to the hotel, and that was lovely. They arranged everything, including from the airport to pick me up and take me to the hotel, and including the transfers between the hotel and the clinic. But I was on soup for 2 days while they were putting together all of the rest of the dentures, the actual bridges and so on, ready to be fitted, which took about 2 days. And during that time they had arranged for me to have soup and so on, so that I could manage that. Yeah. Well, after the procedure was complete and everything was fitted, before I went in to have it fitted, they suggested that I talk to the chef at the hotel and asked them to have a nice big steak ready for me that evening, which I thought was a bit presumptuous. But anyway, I went along with the ride, and sure enough, after I had it fitted, I went back to the restaurant at the hotel, and honestly enjoyed a wonderful steak. Let me say that since I've had these teeth in now, which is 2.5 years, I can say that I have never ever even bothered to even think other than the fact of cleaning my teeth as you would normally in the morning, whether you had full set of your own teeth or not, because in my opinion they are exactly the same and feel exactly the same as what I can remember, which is quite a few years ago now, but nonetheless were exactly and if not better. Yes. No, I do clean the bridges every day. As part of normal hygiene, you know, I would clean my teeth after meals, and as you normally would with your own teeth anyway. And as far as difficult is concerned, no, it's not difficult at all. Yes and no. Simply because I mean I travel extensively anyway, but I was a little bit apprehensive at first because not really knowing what, even though Professor Ihde and his lovely wife and Dorina said that the procedure would certainly not be a problem, simply because they'd done so many, and through experience they've assured me that it wouldn't be a problem. I had a little bit of apprehension, but I can assure you that once I arrived, I was picked up at the airport by them. Once I arrived, all apprehension was, you know, it was gone. I knew that everything was going to be okay. I've got to say, none whatsoever. I didn't experience any pain, discomfort, a little bit of discomfort, but pain, no. And complications, as I said, I've had these, you know, now for 2.5 years, and I can assure you I haven't had any problems at all. When I went back to my dentist and showed him, he inspected what had been done and so on. He was astounded that what he saw. He suggested to me that as far as he was concerned, it was probably the best work that he had ever seen, even though he qualified that it was somewhat limited in his instance, but he did say that it was fantastic, because he also did inspect the gums and so on, which he was more interested in having a look at to see what the effect was going to be and so on when I got back, and he just said it was fantastic. It was just fantastic that what the result was with what I had. Yeah. I have no hesitation whatsoever in recommending it. In fact, as I said, and this is one of the reasons why I'm quite happy to do what I'm doing by saying what I'm saying, simply because I know that there are a lot of people out there that were suffering the same as I certainly was, that would like to do something about it. And to be honest, I believe this to be a very practical, very practical and affordable alternative to waking up every day, you know, with pain and wondering what to do about your teeth. So yes, absolutely, I could certainly recommend it to anyone. And in fact, I might suggest that through Simpladent, if some people would like some assistance, that I'd be quite happy. I'd be quite happy to assist them with whatever they would like. But absolutely, it obviously needs to be done through Simpladent, but I'm sure that they wouldn't have any problems in getting in contact with me and to assist you in any way, shape or form.